was for donko abo apa ho minute eduonu ennan ye free infensi ena abey ye kwa sorry ye ko bompa ye yasan abetena se ye ni wo bedi nkomo e de afa wapomuden ho ensem ho medin de adwa chiwa pressure and hypertension o mama pressure na have cover hypertension aba no ma sa hwo nyumako bi na aso yasene ni abetena se I stay healthy jumedi ebrewo St. Thomas Eye Hospitals, Multi-Credit Savings and Loans Limited, and a discover so yasene ye hwe animu se enche bia enyumako ni bi ebeba beka mi producer Samme Edujemfi Kofi Topaz ewo hoya oye camera de amayen na wie ya betena se last week ye surgeries ya editi obesity so eno nti me hwe se nyame aduma next week me de doctor na oba me de na yewe nso beba because we ye kese na de surgery na yi free ho de a ene na ye mo a se de be ya wunya nru o mo medru ho de nya ne pomasi bre nti o mo munya nru ho no there are ways you will not get to that point esese o to aso na ye koye o surgery na wafu no ye se baby adidi ekogu ni yetwa bi to twene ni eja bi me ko fie medwen ho anam na wo yakubu ha asem ni okobedon so nya aduane isi ho so wafu na ye ma nti wudi a enye yie minim se last week program no enjoy pa ye ne doctor dakwa na eyeye ene die last week me catch us Sunday na World Hypertension Day nti me sorry no kra me catch us measurement no ne wo di akọ na kọhwe pacha wo na mama ni nkura wo ye bisa wo pressure da sen I say mental na no pakoko wa ma ye bo no aka me pressure da sen ni ehu se no kra se wo ya we nti bibi kra to na odru ba bi edru ne de ma wo kra ye no pressure ne ehu kwa ne be fa so a be ye no na ya na mpempi ne se pressure no silent killer na ne hu abufuo kra ne se wo ba wo no nko ama wo ne hwehwe ani mu no akọ enipadua na kwa ni bi no akọ so no asan akọfa o how foforo e de aba na wonim se pressure no wanya da bia pressure dro nko na wonom na enso so wa mo ani ankọ wo nipadua akwa ni bi eho enti na pressure ne so ama akwa ne so aho aba asem enye pressure no ne kun no eye ni nipadua na akwa ni bi eho aba asem no ene ne nam so ema no ewuye enti ene me no bedi nkomo enya effect of pressure on our kidneys. In fact a kidney near the atoso na enso megidi se all the other organs the major ones na na pressure ha omo no enche bia na ka akoma ne de ye be yi akoma na frim na yaka de aka no ne ehunu se pressure na da ye so na ye pressure duro nko a na ye nomo no ye be gya ye duro ne nko a na ye kwa ye bisa se monhwe se me kidney etisen monhwe se makoma na ho den etisen monhwe se me liver no na ho den so etisen minya be me na onye professor efi so be ye professor many me hunu Bible say ona me hu kote ole wa mam quotation shows FCI ni mam quotation show
asa wona won hwe me o hwe me anka o hwe me asa we
me ne Professor Elliot Granting Tano consultant nephrologist ene no bedi nkomo won stay healthy yesterday no a doctor ene na ka kidney they say why prof I learned say o mama no prof o say ye ten hu say o kokase ai wa prof ina ba wi so ye hu prof bi o na no prof ye kidney transplant ye ne prof that time kana prof ni nya mai ye e shada kam na e she fridge mu ye since ka wo ye prof no kranka mu wie na ne kwasi ada na ka wo she prof
so no you busy when you other important speakers are almost 40 listeners into
the prof aba
it is here the main aba into us here can hypertension
ada prof cheba me ka che say o ye prof o she professor for che o so tinwa say professor
sa no muka me nko baba ho ntia
say eni na professor ne ka o abusa for any Professor Elliot Granting Tano na ebedi nkomo yenim ni fia hadada oni edi nkomo fa kidneys ho pa kidney consult ono any penny a woda no o konfa no cha ban resabia makabio say o professor
ajwa
doctor nie sorry ana ye me Dr. Frimpong. Doctor, say there be say prof ni here mo.
But me a doctor.
Doctor Asafo J Frimpong Spectra. Also be a prof. It be good morning, doctor. Hey, me delete my sign prof. I'm say say prof we be come no private you.
No, say doctor na still.
Oh, say doctor. And no body ni wo ho, but okuni na be ka ho ne de.
Me patients back consulting room.
Doctor.
I don't know why confused because we say I feel
but in that capacity you are a doctor.
Yeah, doctor.
But how do you a prof?
In come e be di me a doctor.
Ja. E na make me a prof no.
And KNUST never na we can say prof.
It say who take am me doctor prof.
Welcome Dr. Crownty e me
true. So pache mo akwaba.
Yeah nua.
Pressure na cost na e ba form. Se busumi we amanfo be hwehwe
cost form anke be me de ko form crank ka ofre me ka say oh kirewa se se ade jamia do ho pressure na da form enya sem bi mo enti you de me yan kan bibi fufuro
okay
but enko form so ra na enko
ni decent ni say
nyoma na ikeka ho asem na to de bia e di ho nkomo emfa me nchia wetiefo etiefo me chia mo
prof chacha
ma fe mo pa
prof chacha
na de yaba ye be di nkomo ne di nkomo sa no ne na pressure no ne kidney ne of course ye ka pressure ho nsem de be ka akoma yare ho kakra ne aka stroke nso kakra ne a pressure ha adwen no nti ne enti ensesa ye ne se to de bia nkomo na ye di no e ho na amanfo erafi ebia nkita ho ana se nneema oso mo ye no bi ho no mo ana refi ana ye ka wanti bi
ana
wabu na ne gusu because ana nneema di bo ye kan as simple as it is na ana ne ye din kakra o ka so bi nko exercise because obi ntene nchine so no sa nneema na o feel so kwan foforo bi wo ho no mo doc edro bi eni ho ana kwan kro eni ho me nom no one time me pressure no meja da bi shortcuts be any ho and principles near principles na and one when ye na could shortcuts nature like I think me post be me put it up 2 days ago say obi ho no mo pressure one so ye ka chance pressure one so ni hia na say no munro
okay
na wanom ne no na akwatena ka mu ba bi no bi aka say o eduro tatahwe bi onom ne na e be ma pressure na ko no we gya ye no na to nchen na akwa nom say
bi kwanso na eduro point bi anka waduro ne be ye adwuma pa
no ye adwuma ba won say na nipa da say di empese tembia ye no maduro no ene ne problem no ntu nyu obi o ka say so instead of ubenum eduro we nkwanda nyina de me waduro bi anom ne 3 days pe a e be ma pressure na ko a omukọ gidi and no problem nti afi obi hu no in 1 month and 2 weeks no na oda A&E aden stroke aden akomayare aden dey see oh me jai do no kakra na me ko so be ka no kra ni mpo a kire wa so yare na da ho kosoro na e ha adwen pa
nti tie de wo ke na chese pressure na emfa da konko enye instantly
say Sunday, you can faith in your money and everything all together in terms of miracle. But you nyaka se pressure also. What it means, ni say ebia doctor na a check your pressure no for a couple of times. We who say emba below baby a peno no. Na e wo soro a ehia se obenum nro. Na yenyi no na nneoma esesa. Chiwa na me ka kira manfo na say obi betra menim a ebia we di 56 and we di hwan na ebia na kuma na ho den wo form kakra na ne kidney na ho den wo form kakra doc. Unni bibia ba yama bibia ye normal. Na me say eno ana mema me. Ultimately the way we nim tie enya sa na we nim timra we di 16 and then we di 20 and 18. Nam gudua no esesa enti enyi a wonim no wa wo hwa mirror mu a won say 50 something enim nie ana 40 something ana 60 something kidney no so ana say akoma no ana say yi no so ono so unyini o nyini no there will be some changes what I say enti it is not as if say changes de bia so o sorry a bia obo powder me boa ana say o te polish kakra se na be ya wenimu no e be etwi enimu
ye facial
na foundation na hwan because it is all an attempt to make sure you look like near na looking like before
which is impossible so
which is impossible but you make an attempt nti sanso na honam adua no so tochima kakra yes o du ba bia ube hia se odem odi nro be den ebe support no se na be ya obitimi aye na adwuma no na wetimi anyi na ache
ti so wo oba udu brebi na wo nyini a wo fa some vitamins bi say the be abu friends home so say then e perform na no abesa
replace it nti sam niam na to de bia ye te ase na e bia ya ka say ana say e bia wabusu mu pressure ho ma me o papa obi a pressure na so e di be 45 na pressure aba so a wo se me pe kope duru a e be ma na sesa overnight and no na ma asem no and unfortunately Ghana hands cry the pressure no nya say amanfo enyinko anenya we have younger people enya pressure no cry na hard drink
see the okay say pressure wo busua mu a onye den abenya betom
menka say nya den aba risk no wo ho etini am catch amanfo wo risk no wo ho pa nti say me principal wo me clinic oba no mami ana papa ba hospital na pressure wono so a man chichire won sa unfi ho
okay
because you see mami na wanya sisi a wo be ken kran so na ya the surgery man na pressure da na pressure na ya aduane na da de ne nchene ne yate so na so wugina ho no wedding fia he so me abedi 20 something na wo dada nkwan nko na wo de wo tinchine ne di na wo tinchine ne di no say dada nya pressure na at 45 chances are that by 30 no wanya by because we say now sedentary e bia dada kra no ne de ne 45 because na onante more or ye exercise more we say na say awdaka mu onante udi junk food ne nuama so your risk na what that's what we are seeing the people getting the blood pressure and as diabetes nuama they are younger than omo passing on which means as a generation no yet me kasa me mama wo me papa wo nti what wo ba bi na wo de wudi nchine no na daachi bi no won so ba da wo benya pressure na bi nti na me ka kire mo ne say ye ba check pressure no na nso ya check your pressure na wie no me sra wara ye sure say eduane adade ye di no eno odi a ebeboa wo enti e bi onya na 45 mpo na muntin mu ana say na mo busua ne mu a wo benya wade no kra na bia no we di 60 ana ye kan kra na wanye de wenya but if you are not particular about some of these simple things and na mo munya pressure na earlier no
and how do you escape say maybe wo mabusua mu no me den na me free mu say me yi me ho say no me wo yabusua mi abebo mpa say imba no ye yi e wo free mu no how do you do that
yeah mpa no na ye hwe ye ho so yie daddy mra we abrantie no den obi obeka wo na me nom zaka kra na me yesi no yesi na wa start to hofo nkomodie say e bia daddy enya sa nkomo yi bi wo nya sa nkomo yi ye be kire oni ye obeye na we di so wo ho a se na ye kenya na wo ho a wa check wa fa fake na wa check blood pressure na wa hwe in as much as come no there we are good
okay
eduane die nso e bia daddy didi anyhow na fat nie na oils nie na wine na carbo bebre na wo wa ye wadwen se busua ne mu no pressure ho but intimi de also me de me hwe musu ye so you are eating healthier at an earlier age exercise won say we furu here kasia na wa pe exercise be here na say wo nante more na bibia you are being mindful enya sad dia no kra nyame enim ne you would just follow because you know many people in fact there's a quote I put up on my Facebook some time ago say instead of fighting over the properties of your parents say bia wo mama and our papa wu perfume and bibia good when you brain we me pedai me peka no be rather interested in the properties that they've already deposited in you. What it means is a property you don't need to fight it. It is already in you. Or the amount where you go. And you will, but will nip it's only a matter of time. Pressure, diabetes. Obu okra nipa me wu nipa pe wu. And then the kunu kra unim. Now, so who are 50 years. Now you are probably around 35. You should know. And then they call me mommy. And then they call me papa. Because here came at the kune kuno no ubeti me ye hu bibi. Send a bear ubeti me nyinache. That is how I want people to start thinking. You may ejuma hospital, but enye me de say ye be kona manfo to line tintin. There be me to be honest, anytime I make a clinic, me who say manfo te hono man, the one thing I ask myself and I say, is there anything that we can do to reduce this? It's na say we inviting here to be and that's why when in talk easy. But nonetheless, na hear me because the moment I get the platform, I know say enne ye ka say obi betie etu ho anamo ba ku mienu bi pe fine me nya ba ku mienu bi pe akra I am happy say oni pa kro nka ye ka say in the next where be 1 month nko bi a obenya kidney yare ewu ana obenya stroke ewu na wate wakọ ya chichire ne nsa obi bi wo soro ya ma na drone ya prevent sa stroke no my job is done
na adentina na nka minim say first pressure na ye nkokora ya di na yede na say ye no 40 ni ade nyina na oda pressure duro so
no ni asem
broken heart na
I mean you're broken heart na that's it now you see the lifestyle of your mama mo ni yen lifestyle sisia no say asesa
okay
gone are the days when it was more manual labor, it was farming, it was ejuma your mama ni your papa cry no eno kwa exercise by itself. Yeah, so the white collar, or better now office when you are by age 20 or Dakar mu 90 or 90. Now by 30, 35, I can see a one. And this I because na nka exercise no man ka obey no on ye. Eduani di enso Yen ma me no ye papa mo. Ye te ya ni ye den ye no edi. Se si anso de na fast wine fast wine fast wine na nchine nko fast wine na spices nko fast wine no oils nko a nia ukotena wodidi awie bowl na wodidi awie mu hwe oil ewo mu eno ye ne aka obo na si o nia ko mu no and the crowd does so things have changed. Your healthy
but
kind of food.
The pounds where the uchi mwana wana na mo.
So say the dear. No yet the area so why ye aduane na oil tie ni near much as a suku. Ebi those times so my be ni kontom rechi e ni na enwo keto bi muso onisika nti no de enwo keto bi egu eni a wo de weska it we hwie ni bebre oil we hwie ni bebre nti won say lifestyles na sesa. And that is why as a generation lifestyle na sesa nti we are young person now you follow the current lifestyle, then chances are that near it is the tip of the iceberg. It's going to get worse. Because now those times stroke beba na one beba 70 years or baby no. Now we are seeing 30 something with strokes. We are seeing 40 something with strokes, and they are dying all the time. We see, and I say me sure say on the air obi 41 42 you say or you say anapa back na
what a shock.
What a shock. To the be a shock. To the be na make
they are aware.
Either they are aware, and now say for me, if they are listening to Nema Yekan wants them to have checked
and
to know. I mean, I had a friend, be younger brother in Accra, ye about table tennis and all together. He was actually his younger brother. That me why a friend me I say well who's that say I say ya na mba ako cinema wo school or ko adwuma mo du adwuma mu a ya say bra or that form and sana on bedu kolebu no wuko
pressure.
So all of a sudden, because I knew him, and I knew said the father and mother had hypertension. So when I clicked that, could it be it? Me fry ya. Me say, "Oh, my postmortem. On your postmortem, apparently na come and say yes, and the blood pressure and namsoro on shutdown num. You see, for me, some of these avoidable, I should say, avoidable deaths na hemorrhaging. A wobia ye near me year inka we can avoid. This year we jana marketing kitty and now what? Why? Because it be an in-rose or no man or be check. So, tie me a mesro. Pressure, I can once me, and yes, I tea baby, I nishi, ye becca can once a more. Near you, I will confirm not near you who were you, a hard dream, as a film. Until I you didn't come on, you didn't come on, so we are so passionate about it. There was a clinical meeting, I think about 2 weeks or so ago. Normally, clinical meeting, Department of Medicine, and the PBI meet cases are banned on There were a set of about almost 10 cases. Can you imagine? Almost all of them were related to hypertension.
Kidney.
Hypertension.
Okay.
Pressure. Yeah, pressure. So, and the pressure has led to stroke. Back well, and you see, in Nemasano, eduanom na adofo mu mesrew se ukwachichire nsa ne ye ka se wosoro a enha dwen o because ye waduro ye okwan ye befa so ye bete so diet ne I'm sure say e benya mre ne ye disa hom ne mu nko ye okwan ye befa so ye beso ano ne ye ha dwen ne se nhwehwem bia ye ne kire se uyi nipa oha over 60% of amanfo a ewo pressure omunim some wo pressure minima manfo etie nsesi a ba dodo na ebia omo pressure crapo a dodo na anim
ebi nso mpa hunu
so and me ban in order so over 60% of people who have hypertension don't even know because yanko chichire kra na ehu ni emu a time eti yan chichire kra na ehu nti ya kasa dede ni den dey also me nchichire
sister me dey the blood for recon one fe hu ameto me
me say those times me measurement month be am say na was a race course so den akwa bi ona na boss buy na the boss na tena se ya chichire na nua ma ye bi free yan just go ye ojina honom na brante onye bi
me I don't need it
ojina ha na wo twen na mana ye ne de awie no ye wo de apreko ye nyiska o ye nya hwe me mpese me
pressure ne the pressure ba beto
me mpese me hu na me ka say abrante mpese wo be hu eno na ye de ne sa na ne hu yo abrante na ne hu ye ne de asha be fo ne ne kan ko tere bia be fo no omkra omotekra no mate shock me ni mo hwe
sa be fo mu ni defenders
me hwa ya ignorant and you have opportunities like this and ka be chichiro nsa wo forma hallelujah wo soro a kwannie akwanchire nie
na the only way I be so pressure and so be chichiro nsa
say obi easy upesa, you know, pressure ankasa normally no encourage nchire. And the money you know. Me dem nyanka, I tell my patients all the time say me nyanka pressure na kidney area it say malaria na say covid na bibia enya bo wa mtimi ntina fie oba yare to the extent say also ba hospital there be, but most of these so called non communicable diseases no phone that corona pine. So na ne hu yo anope ya ne ne kasa yo say ya plan there be, so check it,
okay,
because in majority of cases encourage nchira. Now say 60% ya enemy now omo a ya check pressure no ye hu say pressure no wono so now so o say me de me mfa duro almost you about 60%. Into omo wakwa chichire o ye hu onimpa say pressure wono so.
Okay.
Now so e be a doctor actually drama and now so also call hospital ko je duro o say there be almost you about 60% of omo or ye den omo pressure no. So meaning say large majority no so no still omo nim so omo pressure no omo mfa ho duro. And at the last batch na say obi o hono ma onim say pressure wono so or fair duro. Now so still BP and now Adam Honam Soro and ma form almost here over 60%. So what this means is say in large majority of patients, you know, even omunim no still pressure no and ma form. So it got. So the point is say if this continues there, then stroke ni you better was of
course.
Akumayariano no keeps going on, kidney area no keeps going on, and so on and so forth. And that is why the whole of the month of May, you say pemere. Dakro bako, buffer pharmacy shop, buffer babia sfig bambia na wadam fubi obi chichire keke.
Doctor na chichire obi anenim chichire.
No, obi say babia.
Me ba obi so adwin ti awaye na adwin say won chichire bi oni say obi am no wrong diagnosis my am chichire bi abeto ne so. It was won chichire bi.
No problem.
Enti say wo say chichire ti na ma babia na ya chichire.
Good. Enti na me bobo recognize places. Me kan omo a woto shop baby na ye de woni mo ya jama na unim onokra or can pressure natural cra ni unim boni go to a recognized place. And thankfully Ghana Health Service there are some facility for a wellness centers.
Yeah.
So you can always walk in.
Primary health care you crab.
Exactly. So you can always walk in and just say what now person here then ochicho pressure. It's a hospital.
Say hono mo chichi o me say tufo.
Exactly. So it gives you an avenue to get your blood pressures checked. Yeah, business. In fact, Ghana Health Service, they just like May measurement. They be about say we want to check like 1 million blood pressures in the whole month of May. It was the same theme we had some time ago with the May measurement month, where our objective is say, oh dear, Serbia as a country,
leaving nobody behind.
Thank you. Just make sure you are getting your blood pressure checked. Any boy in your day and you be a check, so it's a few minutes. It won't take you all your time. So check it at least before the month of May. Ya checking there was sure say na ye kan no akwankyere wo ho nneema ye betu fu a say na be obeden wo betimi a control no o checking so na ye nso a again ye tu fu say nyame adom bibia ye kama to aso na ye whatever you are doing na aboa ama BP ne ye kama, and then we'll continue to live on. Prof,
don't you think that we are over focusing on the pressure, but ya de na e wa ase na e de ba no I'm saying microphone no more pressure na nkasa o munim.
So indeed in most cases, and that's why we focus on the pressure, no. In most cases, about 90-95%, no. More pressure, no. To be honest, the causes are unknown. Yeah, friend essential. Okay. What it means, ne say, risk factors, ne denam.
Okay.
Iti amonsa no. Me mama wa pressure, me papa wa pressure. It be a stress, it be a many exercise, me nom jot, me nom onsan. All of these things are now salt intake. These are risk factors. At the comporting the pressure in most cases we don't know. All right. Now in that 5 to 10%, there are underlying causes, and of course that is why I'm particularly interested in it, because kidney and na control blood pressure.
Okay.
It is a mechichire wonsa now pressure no was through. I ask myself, especially anybody less than 40. The question I want to ask myself is na ama pressure no kosurana, which is something we can correct. And of course there are possibilities, and of the secondary causes na pressure na causes the majority are kidney diseases.
Okay.
So for me intina me no yana me fan work up
no, because chechire ne keke o chechire na say wo
sura you have to follow up.
Okay.
So ideally o chechire our health facility they will ask these questions. In the sense, and then now pressure no was through. And then again, no, you nim so say pressure no so complications. It normally a full battery of workup ebetwaso.
Okay.
But the starting point is say at then now pressure no was through. It's you check kidney na ho den. E be check your thyroid and as you be from man no you be share say e bia unno monrobi. Obi one to be honest, the pressure no na big deal. Drobi na or call hospital near trauma no for especially
Other
steroids,
things,
other things. And na ama pressure na kosoro.
Okay.
You treat you na pressure number from obi any asembio, right? So there are some that are correctable, and I keep on saying say bia bibi to say bleaching, for instance.
Hey.
Uchiu ho o person ya kokko o say you tune to me the own baby.
O changing the house.
O change housing. Thank you.
Yeah, there's a monkey's man.
Na enema na sa ne o di change housing no. Content na ewo mu na bi wa na steroids na ewo mu.
Okay.
E pour ho no na kakra koko uwidie ni mo. And no sa no o ka say o mejai bleaching na say here chances are that pressure na e cause through na beden e beba form. So there are correctable causes of the hypertension no. Eti ehu a ya so ano a we are good. Okay. But if you all know the large majority no so ask for the risk factors no. It's a risk factor no what there when it is on, then most likely it might not be a correctable cause, but near be nya say you be sure say enha unipedua baby en cause akumayare into we say you hwe we abeka so we akọ ECG ko twa photo and say x-ray and say ko hwe say into be but the by and large the moment the BPs come down or risk of stroke or akumayare and as a kidney disease then it also comes down.
Headache na pressure o pressure kosra and the ma unya headache.
Good.
And na unya headache and the ma pressure kosra.
Very good question. So sana meka in most patients pressure no ho enka hwe nkyerɛ wo.
Okay.
So normally me this ankomo na menka say twɛn utie ya ana wakoma ba prepare na wako hospital there bi. Nkomo ne say ko check it. Whether you have symptoms or not. Yakako screen is screen ya obi o twemu keke obetina se ni pressure obe check na 200 na ya check ya de ka cry machine
bonu so nim
hwe eden na ya o hwe nya o ko ni dwom ye munya ntam kra no nto aso nko etore bia we are forced to say yesra wa nka facility normally akosa na ye ne facility liesi na omo akono omo ahwe no and all of that stuff. But some might be in code fortunate where a beck can be biachero.
And the other becca
Intinia catch it on the say Utioya because pressure no cosra and the mouth in ya. Ubu Mujef in Hinimuba, pressure no cosra, it mima Mujefu him.
Sati area no a normal city area be your types. Mosibako and Moma Isuha, Ibuha Utifa, Ibua Utini, and I bones or Tija gaga, and as I bet mammy. Utida wadro so a ye boom
headache well a tia a see it is we organs be brave e wo training.
All right.
So depending on what when you cry for some reason what space now I wadwen say what the better ho na won she cry timi ma otiyare waso bibi cause waso no ma timi ma otiyare sinuses etimi ma frontal headache etimi yare etiyare ukotu sin and answer when yakaka it me multi-area. So there are a lot in this head alone it me multi-area apart from the generalized headaches your friend attention is no. But what I would advise and I say let's me and train ni enkomodie what yi a nyame adom ochina na sende wo ba bia obetimi achichire na me hontom wo de ka se wo chichira ma me
prof no
wo chichira ma me ni ewu to de chichire na me ni ewu sa etu chichire na kama yin ani age nanso wo chichire na wo soro a membo se na wo kan na bi wo na ya chichire ba akosoro na den bi normally ni na say ebia bia bibi na ekoso enne obibu efu wan na akosoro chichiri biom na san chichiri biom on 3 occasions e da ho osoro dia na yesuro say e wosoro for which are also kone ehwew now na make can say bi was symptoms na betimi ama on bi say betimi ama uti ayo ya that's one of the very common symptoms
that's pressure
osoro yeah to say uti ta ayo ya me patient bia na ne tie na ya na wasan ko no painkiller gusu oba na ne kidney na ho den da from nti say uti ayo ya na
nti na mi bi sa headache ne dey obi on man ti ta ye ne ya pa ba ye nso a painkiller no ono kro mfa ba ko enra be 9 na mesi me bo me tiketu abi na baba wa bi
na ketu ade
ketu abi enye di esisu no hyase
yo but
so fe what I say ketu abi
and on the foundation
say no dey on tu ase enti busa for prof be ha dream na ababa wa bi obehye lashes into owie o say aseniti o say bibi yen na o mama no painkiller bi edwomfo ne pepa oh yes e was salon ho edwomfo ne pepa me besi me boni din wo ha but obi ati ye ne ya am say no no mo kire wo mo oba ne se ba ko no mienu ne nso no no yi nan e na odi gu nanum kro na metwa amani sei e na me hwe no no obi sa me say aden ade asa me asa
okay so you stay healthy
no my break baby na me free am abedu no my break me kasa because wo be sha se omu nyina yo momo na yi ma no omu nti ase se wo si ni tie na me se mababa wa be kwa akoboniti ye kwa me fasa akwa
ba wan hwe ni ya onko to the same set no nti oni ba kro no me wa me se no
so omu na de ma no
nti for me you know those opportunities no ya let's not miss it
okay
because for all we know no ignorant one no one kono onom ye je no obeka se oh eduro we tembia no nom ko so tell me can it normally no say ye nya opportunities ana you hit it well, at least say it that eduro ya wunumi betimi ayo abcd say at least wakako. And for me, no, I am so mammy I don't care where I am. Bibi bomu dia mbeti mi opinion.
Because
no. It's not what otwaso no monso a ebia kidney na ama pressure ya kwasoro.
Okay.
Now asan ko no painkiller bia esa ha kidney no. Into pressure no emba form that entity yare no it will continue to go on. It is at yare instead of say obeko no uti ya call hospital near ya yanhwe ne ntia uti ya bi kra na ehia we na bia na say bibi foforo bi na wo na ye treat na call baby but to chronically take some of these pain medications na ya na ode o ha on ba no. So the key thing is say ebetimi amoti ya dodo wana so ebetimi amakoma bo pepe nti wo ha you can hear your heart beating. What you are heading combo in this our test wakoma ebo.
Okay.
Akoma de oye na adwuma ba enisa wote. Wo test akoma na ebo gigi. That could probably mean say oppression no was so. Obi wo ha na ne nisu chi ne kakra, obi wo ha bia na ne na ase ne tititi ne nnuama nti, but in most cases no san nnuama nkitinkiti na se na e kan ye no we have ways around it. Oh beko ne ya no painkiller ya ye ne say come na so na e hye sa na pressure yi da ho kosoro and then one day boom untimi nkasa untimi pejana na nsa untimi pejana na one day afi ne nim nya na pejapejana na ase pejapejana ana so untimi home ya say heart failure one day na na se ne nim na pejapejana ya say ne kidney na ho den na asan akofom. Now one thing with pressure na kidney ne say na be kan no kidney yare is one of the most common secondary causes of hypertension pressure into kidney yare no form
and the kidney pressure na isa akukọ ni kosia o ye hu de because enkomo ya shase no enkomo ya shase o se pressure ne cost
thank you
e ha kidney
thank you
is a kidney no so hu ba asem oh my god
the chicken and the egg into normally make us that's the same example I give.
I see.
But however it is like no ye hu se pressure was through ni ye hu se at the same time kidney na hu ade wo form again the solution to the problem na see be ma kidney pressure na eden abafom because ye ma pressure na bafom and twaso nsay kidney na ho ade so te ase at least baby a kidney na ho ade na say akodu bia na ede ya maintain no but wu nim na won so wan ko check here then na fe kidney na ho ade nti wu nam ho won check o pressure no e bia kidney na ho ade na wo form e na ma pressure ya akosoro pressure inso wo soro no na say kidney no na kidney no so e ya wo ya na sa nti wan hwe ankate that vicious cycle wo baby a then what it means na say mehu no na kidney no e na pressure no very difficult to control afi ya be hwe no na ya be scan ne nneema metimi aka che osa we me sure say pressure na ba also be mfi ahini
ani doctor no waje so sa
but at that time no to be honest magic be anywhere me afi say o yanko da dialysis so and I yanko yesi and that is in common to be honest need me din but in some cases and in most cases patients be ba no in common also di anu na yes they are going to die
mama fa we ntwa mo patient no ho te say transplant
no way pa in fact should I say omo ho ye pa
because
ye chi dedi nkoma che say transplant ya 3 sets oh
ye na me ase
ya first set ya second set ya na third set ya
to omo nyina yo
ya mi adom ya ho omo ho ya the first one crowd in fact on media
ono na o se nko ba ni di nkomo be di adan open so obetimi am ya kata nanim na nko wakasa.
In fact, Ebedu baby now he was because we've gone past 1 year now. His kidney is doing well. To me, didn't come from beginning. They're not very careful, but subsequently, I said, "Nah, also mrebemu a obetimi aye but I think so no kra
World Kidney Day yen hwesi ebenya na
I'm hoping so be around because when me din kon wan hwa na wetu kwan
okay yani obetu come here recording
ne ho ye pa ma
otu kwan me caring for the kidneys ni mo bebre because enya den ya ebedi but pressure no ho no na isa abomi ho no
exactly
se
kidney yare e cause pressure so osura e cause kidney yare
enti wa uti ya wo ya o pressure koso ya uti ya wo ya enwumre bia udru fi a me mano ya medu ba no wa fasa painkiller no wo onfa mienu mpo onfa baako
no baako mienu njeme agese for
problem na me no age no anom me sister we dey me no ada me da e ya wen na hye ne bag e ya wi abo me fa me painkiller ni bi asi se doctor na trauma no
no na me ka kira manfo say painkiller for instance no enya boapayo say ukọ hospital na uka say oba bi ya o ya doctor mawa obema oba 5 days 1 mawa 7 days why because at the corner o treat you know or you sure say within that few days no na at the corner ba down so enya say oba no painkiller na che
okay
monso de monum painkiller na ejimo a afi anytime bia bibi fufuro bia wo bia na wakwa fa no won onum painkiller na cha to be honest effect ewo kidney no so anya kidney no kwa nso wakoma no so and all no it's far fetched say I'm so worried exactly that don't take a painkiller without prescription. Never take any painkiller without prescription.
Now painkiller when you go hospital.
And no near some no. And that is why, to be honest, there are some pharmacy shops, good ones. I mean, person may advert. Patients I carry so call so kwakoto. So monton man if only prescription. Now so the vast majority need so sika near paji with their brain. In fact, omukra be chira say
we na know
which I don't think is right. So let's be worried about painkillers. But I think message and person manfu when they say pressure it may affect your kidney. O kidney na ho den so wo forma etimi ma pressure e kosoro so pressure also especially undi more than 40 years mesrew pe na yehwe ni ntia o pressure no wosoro and in over 80% of cases it is a kidney problem.
Me advocate say obi a pharmacy say nkokoto painkiller yenchichi ni nsanza.
The pharmacist Nankasa now, I'm happy. Most pharmacy shops have sticks. In fact, it's one of the great things. And about Mubumutino, there's a paper. There are now places like the barber shop and people keep fixed there. There was an initiative in the US some time ago, the barber shop blood pressure check, where barbering shops have the blood pressure checks into Uba Honomoa. And by that they are able to pick. So these are things. Baby to say Kessben, for instance, speak be our hand on a month for to me but check within the month. Why not? You know.
So you was that clinic.
Exactly. Where they can check it.
Nurse na kwato do no aba so but abonte so for so betimi aba.
No what for no aba check it. Yeah facility asokwa. You walk in pressure there oba check and I feel am say for coming to check your pressure. It helps you to know your blood pressure. Yeah, screening severally over this a year. Or blood pressure. Kessben cry a lot of programs. The Mother's Day, Father's Day. So
Father's Day, Junior, Mate. Now, doctor, kan ya chechire mehunu, ya chechire mehunu. Mebacho na mi bisa say chechire no mehu say na menwane. Uso obu o ma wo chechire kra, obu okra obi ofie. Me kan say wa friend ba no ma me ni be chechire ma mi na de o mo kan na ehu. Ohu figure na ohu de o.
Me wo patient bia o say em say na ne de ne say fi China o say den bro near e wosro no so pe e ma red light. I like to say we are broso. So technically speaking, for public health purposes, no, you can say BP no, ideally no, esro de no, also unya be 120. Asia de no, also unya be 80. O BP no etesa plus or minus ye kama. Akosra utifie no, enisa bro 130. Asia de no, enisa bro 85 and 90. Enya do 140 90 na dia na je say aginsim non sa na dia also ko na obi hwew na ye hwe ne ya betimi ya aboa but at least ansa na obi be hwe on mpo na nnuama we na ehia te wonchene so.
Okay,
so key things ansa na obekọ baby wa fe no decide say obe den obete wonchene so me futu amema na say wa adwen say oto aduane wa bonten dia na forget about say oto wonchene so me ni aduane ya to wa bonten anchene nim nchine no dose because yenim say amanfo pension
ebi nim kro bi si table no
so yanti nchine so say wo de kakra bi hu say oh kakra bo mu but eni say 3 mu bebre that would help a great deal. We obi nso a mu ye du nso a start na exercise kakra eto de bi exercise me nka se kodon gym anase bibi nye no ngunguran eto de bi a wa ofie compound so na wo nante na wo ko na wo ba na wo obi okra obi afrɛ wo tena se na wo pick call no mpo no eto de bi a call na mu ano utimi ye den e di pace up and down e bi a wo comfort no for instance and wo ejuma mu am wo lift but what mean you say lift no ya wadwen say what the stairs no be the example and as exercise nti obi a also called asie ho no ne security man ko kasa me mfa phone mfrɛ no decide say shut down nanti alcohol intercom ne doors nti there are now structures no has made it very difficult for us to exercise. So sedentary life not does so. Like I keep saying, we have become a generation of sitters. Yes, sorry, I had to the brand. Oh yeah, the brand. It's when they take away delivery. And the Uber. Those times because when this crowd the fucker and wafa trotro ni nsi where you mean meboa. And say Uber boat. Unya crank or no crab office. So we don't work for anything, right? Into some new na me again with ni and check here do no. Simple things. My vegetables and the fruits endorse.
Okay.
Ni ente carbono so simple. Yente fat and oil and your money yente so. I keep the advice very very simple. Portion control ni here. Obo abetra in doc any then ye opeso ka zo untimi ndi fufu untimi ndi wache untimi fat. To be honest, ubetimi edi everything depending on the portion. Who do fufu na fufu ni e kakra bi. Na bia se nkwan no rather na bia watwitwa se carrot ne cabbage ne ma na no mewa. Chances are that no carbon by the ebe ketu bi. Nkwan ne se bunebune ne nneama no enu momu mewa. Eno ya much healthier. What I say? Send me my example. So let's be mindful and make a mentor if you want to control what you eat because everything out there and does right and now insane. You see, insanity, we have different kinds. We have different. In fact, insanity or misroka no more the gumu no crap by itself no crap more be because
I'm a energy drink.
Hey, na energy drink no because once a cafe and no more no the gumu ma ya krakra no and also can push your blood pressures up. So why don't we stay simple? Once you be now no muncio or your exercise be let's keep things as simple as what possible, right? Open juice, please. I would really advise don't even get the ones in containers because they have a lot of preservatives in there. Orange ne, what they are showing why refined by no crack and meal, right? And then it gives you free bowels and it is healthier. So there are simple things we can do. And then sun also by itself, no so no man. I don't know what status symbol and that's a culture of insan nowadays is, but please, insan is not helpful anywhere. And wow brain no and wow
evidence of good living no. Say be man number point dwuma nwumre unwa entina se no makotena table ba ko no ma jensa ne nam nwumre na be ma akotena se ye pintoa
yare nko
na ye fra fransa ne bi so
and the culture that comes with it is a status quo and you na baby just say oh your dog guy and answer whatever it is that they want to call you. But ask yourself, these people after 40 years, after 45. In fact, I actually spoke to a patient be some time. In fact, he came from I think the US, was a UK, now I'm a refugee. I was like, doc, nana down for be only now US was a UK, no. They diagnosed them with hypertension together. Or say na or serena down for no. For say and so on out and all of that. Now he has a stroke, he has a kidney disease, he has that, and he sees his nadamfo and then nadamfo is looking. I said, doc, me no me ho. He said it. Say me no me ho.
If you could turn back the hands of time,
I could. But you see, that's the conversation. I'm in person. Yeah, we inside. Yeah, parent. Why? Say all you are saying now, but it should have someone. And to be honest, I feel now he tells me, doc, I feel me jai. My even say, where jai dear? We cannot do anything about it. Now we have to live with when you stroke, you have to live with kidney disease and all of that. Meanwhile, now Danfo, according to him, now Danfo is doing very well because the moment I diagnosed him, he was particular not son and lifestyle totally. So almost cry. So then I said then, and now he is very healthy now in his pension, living very well. Now look at you. Every week you be out to hospital.
Abusa for yenkodwa somra enche me mama ba mu bi me de ehia me pa doctor aka na wie ni say ye kidney root my pressure kosro pressure no kosro so enu timi ya kidney ti ye nim de ebe ye
chicken and egg akukọ ni kosia
mystery kidney no yare na mystery
enye mystery, and that's why also ye di hu nkomo, because a lot of people would come and we are able to know how they got it. Enye mystery sir, kidney yare there. And that's why in Cambodia say na hear me, because here in the next couple of years na man for a better dialysis so and for, in fact the government cannot, in fact, and we cannot, as healthcare professional we cannot handle it.
I was for Divine Key Believers Network International. Womu ena ebe bo osofo kankam abaso se osofo kankam yebe man special appreciation ena honorary doctorate of divinity awards. Inti nyame adom a memene da ebe ya 30th June 30th May ye nyina ebe hia wa da Woma Senior High School. Ehọ na nyame adom ye kobo osofo kankam abaso ya free na week de mesrew no osofo kankam Reverend Dr. Vincent kankam ena ye de ma no. Dr. Ekasa doctor say eti yare bi okra o space yesese wo hye no wan hye space na enu timi ma uti yare utini so ayeye wo ya you be forced so obefa painkiller ya wo fei ensem bebre St. Thomas Eye Hospitals ye to yensa e dia frɛ na no Mother's Day me catch us when ya hwe ama ma me krampo no faniko St. Thomas say yen hwe n'anima no sa Father's Day so nam kwamu a eba fa o papa eko St. Thomas ko na yenhwe papa anima no na nanini nya fra wi a gye se wo gya adwuma ekotena fie ehwe no St. Thomas Kumase hey ye wo ahojo afsadan ni mo Champoma Towers ehɔ na ye wo dankro ni mo antivic ya wo boutique ono so e wo hobi enu nti mesra St. Thomas to ne nsa fra ni ye hwe no wo eye clinic bia ye hwe bi e wo St. Thomas wo wa wutie won kran ye o mataiko ehɔ na ye wo bomodia na bra ni ye hwe wani emfama ehɔ mpo de science surgeries eka ho me hwe mba as when ye chimakoto baby ni ade ama o confidence ekọ form St. Thomas omo the laser brofono laser doctor we call it laser omo the laser ebe ya ama a wonhunu hwe sebi wani ni betene kama ama bibia aye kama wo ye drop ani wani how obey wo kosku ananu BC me say me call center baako akra baako su paper ne da nani mo hu dam so ma me aso ode o ma me aso ode etimiti Kessben TV ka ko St. Thomas wa anko je space ama obey say akra nyame amfefie no ofemfiche no ofelia nya bon no abon wo eye nani na eha no fa oba ne ko enem usori a ena Madam Peter Space ye be ko conference ministers conference ho ena oso akwaje space no okuta ne Bible no to hye no ohu ne kakra bi a ya testi wani no ebu okra se nhoma na esen chire na ho aba asem ni nyina obi anim no ane so oso akwaje space etim nani na ode kode ba me kafu St. Thomas e dia mawo mu ye nipakuo bi no maboa mo ho no mo frɛ se ye me specialized screening mamo a ye beba abeye number ni 0537 211 531 0537 211 531. Dr. Jesse, good afternoon. Dr. Jesse, St. Thomas Eye Hospitals. Dr. Ekoba Jesse, good afternoon. Dr. Mechao number 3. Dr. Ekoba Jesse, good afternoon. Dr. Macha Dr. Jesse. Ana Mecha Dr. Jesse will say that.
Mona moti asienti. Coded, heavily coded in the
Dr. Jesse won't cry. St. Thomas. Doctor, good afternoon.
Afternoon.
Okay. Doctor, I'm a tear for near for Emremu, by intia foot to the mobile. It's a quani ebe faso ebe boy. Na pressure ninya cost through ya, and ya is here an net here. I bet na you move. It didn't be a boy a brassing. Let me phones.
Near here, say pressure, send a mechano 60% of or more 60 or how in chim
or how much more do you see?
Or more pressure now, omonum ronum bono and you're controlled. So what it means is say, war pressure or see a sure say 10 beer, over check then 120 80, 125, maybe 130 as allowed.
Okay.
In Nissa Brosro. Now, o check who pressure na time bia now na 160 170 still no nia ye ka say yesuro say be ha no say be affect two kidney and say be more stroke and say hakomayare it can happen. Okay. So what is important na say ya ka say so no always ensure it is controlled. How are you going to ensure it's controlled? Me sure say Dr. Bema we drew. Me srew ade ba kon ha dwen pa na say. Ye sha se ne ye mama drew no pe. Mo say oh e be a side effect bi nti no wagya, especially making na me kokon en mema na line.
You see how
to be a mema no. Aha. Now near me can say, and I've watched a lot of my patients from beginning. Ebi ani BP is nam 200. Kwaku has been used to BP and nam 200. So na be obetimi ama be me ye gina. Eti time bia 200 no nim. Na fe yesi 200 yi ebe ma stroke, ebe ma akoma yare, ebe ma kidney yare ne keka wonti oh yamfa mra 120 130 kwaku ontime nsesa na adwe prekope ontesa na adwe nya adwuma sa eti onhia abotre no na wa fompa in fact the reading skills was through anka mema problems ayekom nka yenkom bebreza o by wa fompa. So it takes time for him to know say oh nia eyamaye what I call the new normal ni. Now, a lot of my patients almost share see pen me two omofo say enye eduro per se because yes, you say no ni bi wo ha affected directly but o me hwa be ma me ma weduro a be affect o be ma no. Now so pressure na ba down nko anti eno krampo ebetimi amakwaku obe adjust and I be taking the time to adjust. So me nya ye eduro no to aso na nom man used to that 120 130 and give it time. And a lot of my patients, that's a conversation, and I'll have a frank conversation with them. Say, this is what you expect, but don't stop. But I won't say, almost shall see no muhuna sape ni ejai near their share drone. Ebi ana nya drone per se. Now rather no makwa kwa herbal. So make sure say oh no me drone. Unu me drone na me cancer masamba unya problem bia. And a side effect bia go back to your trauma one say me no me drone ma metie me ya me no me drone me say me no me drone obetimi asesa men ko baby foforo mo bi nko fa bibi foforo ade or how foforo be brain because mu jai akwakọ nom sa bibi drone ya kan kidney na ho asem dada na no so say kidney wa wonum painkiller say kidney wa wasa ko nom bibi drone o san say no na o say no na afi wo be ba enya dialysis asem na me kan kire
na aphrodisia no so
hey mranti yes ramo aphrodisiacs near a shame. Now listen, to be honest, let me say this. A lot of men, a lot of young men especially, who are taking aphrodisiacs, bed enhancing and grono. To be honest,
oh why?
Because there's that mentality that oh if you're on your bed, also on a bad bear 1 hour. Or there's that mentality is also on the bed 3 hours.
For what?
Why? I don't know. Thank you for what. So inka nyanko be hiya ni obaba kwanda no inka onya edrobia. Now for some reason there are a lot of young people I speak to near obeka chiro cranty or coffee and you realize say you don't need it in the first place. Now the content of these medications now when your bema gets used to it, afei one no more you don't get an erection. But meanwhile nanka unya
it's a psychological problem.
Thank you. In most cases, they don't need it. And now it has become business for some people, right? To make the men feel say they are not good enough until they take some whatever name they call it, which is bad. Do we agree? So maybe a member do age, I don't know, 70 or 80 when you near send a yaka say near call for me, a call from fair. Where the 23? Where the 25, 28? What the aphrodisiac? Thank you. But you are a young man. What do you need aphrodisiac for? Is that mindset some young people have? Now make us say me. I've said it on various platforms. Say, what do no? A mad do na person on your mother. Okay, go keep taking it. Content na woman win and its ability to affect your kidney. No, now a how kidney na ajwa. The point in say oba na yeah why say no me drone they are satisfied no. Obe who say when your kidney area onya ho ye kan kra ware wo
asama okay wo michim no
obeja ho
opre ho ana wu a ofofo ba
obeja ho akwa for be foforo. So I think men we need to be wise.
And I feel married men don't do that.
No, they don't.
A girlfriend or person impressed.
Obviously. So at the end of it all, no, for what is the question? So at the end, yeah, project
impression.
Yo. If you impress it, now you keep your blood pressure and your kidneys intact. And there's a menu niasam. Now musuka now kidney the conformer and the oba yes here you say there and so awesome. But we can avoid this.
Sex
so
life,
young men.
Headache,
I would rather say that good sex, for that matter, should rather reduce your stress and for that matter, help reduce your blood pressure. Oh, for obi what is some check be stress and will let you. Exactly, and all of that. So sex itself has a lot of advantages, and for that matter, we will not say sex never more blood pressure. No, on the contrary, I mean, after good sex and all of that, you are more relaxed, your stress levels are down, endorphins are released. No, your blood pressure should come down.
Which one is the good sex?
You are married with your wife and your wife alone. I call that good sex.
So any sex outside
marriage, I won't call it good sex. Now do money be and now you can open and papa open and tell person you are devising also you can then make a catch me and then in a way many way are done side chicks or me you are figuring out how you play them. I mean, I don't know. And all of these things will stress you. Apart from the fact that it will stress your pocket and so you are wasting money.
And when your pocket is stressed, you have headache
of
too.
Course, at the end of the headache never. Then yet sex nankasa. So I feel, I mean, as a Christian also, I feel that sex should be had in the proper context, right? You are married, you have your sex, you are good. Your blood pressure will not go up. You are relaxed. So
if you're a married man, that's our pressure was through baby. If you have good sex with your wife, pressure and back off.
If you have a pressure, should not be put aside.
Okay.
Check with you then no monroe and all of that. And indeed, sometimes working on your weight, Sir, I have patients, I set a target for them.
Okay.
That listen, wait, ubi am I no baby to koi, ye need a tea weight and also to about a ha. And no crab mama pressure no. If I have actually have a patient, Central Market, ni weight na bad down no, then the pressure no you know some I stopped everything. Because she could now go without blood pressure medication. If I do baby or buy no Dr. Elliot and say my mom for whom here almost say and I say oh and unfortunately for her and also I said my may passed from some cancer and be in fact say Dr. Elliot pressure I feel maintaining can be for a long while. The next time I'm in who and was in that them or friend was in the Tiania, and there was the same the Tiania or no or friend who migraine. So migraine one, so migraine, and I told them migraine. Or pressure and I was running them out here. Your more pressure and about for migraine. Now, or Saya can see enough into a friend, and I'm saying, why can see you man? That was my first question for her. So maybe or buy me who hey, how did we get here? I feel exercise no jaya. I feel wakosro and blood pressure na kosro.
Inti doctor say me go so chiche me pressure. It's science so so be nya o me kidneys so inti me call hospital me check me kidneys wo.
In fact, ye nya kase o pressure was so pe. Same day. Say nya weekend nko lab apon a ko check kidney na ho.
Ko KFT no.
Ko ye mami, ko ye na gu me ni mu ase. Mami mfere.
Okay, 0551599933 0551444933. Pacho ubetimi afre na ode o question aba de won't ase no oba doctor be answer ama we dey pick and cry wo kan na doctor ejina so na we yi wa no on tron to answer wo kan say doctor ejina so we yi ano e de ama 0551599933 0551444933 also ubetimi me say me fa na address
Here we are now.
No, you don't need it.
Okay, good.
0551599933 0551444933. Everybody, me say me fa na assign a drop it. Doctor, inside emre bi whilst I train say calls no. Ebetimi agina so na abano. Mame emre bi say me hu ne say de bia ye call hospital na. Na ye ni ene yadwen e wo pressure ne so. Eti no ane se me kwaje me pressure do obi ada pressure do so mfie nnan mfie num on check any organ bi ada.
Okay, so ideally say na make no organs are pressure na hapa wadwen wani wakoma o kidney and I told you o nerves ni bi. Okay, so the key thing is say anya every year say ya ka say na wa check na o kidney na ho den ya kama hallelujah. But at least the next 6 months and I said the next 1 year, okay. Because one thing with the kidney, with the pressure, it can pressure no cause it can affect the kidney if an acute kidney injury acutely.
Okay.
And also no me hwɛ nneɛma bi a me hu sɛ kidney na ho na akɔ form, but the moment I be control pressure na pɛ e be correct it. So anytime I be ka say pressure also no me srɛ wara you sure say all of these organs nti bia wotwa photo ana say we na free ECG na e betimi ehu ne ekoso wo akoma. In fact doctor cried me examine wo mpo a e bia otimi hu say wo akoma na ye kese ana say wuntin no epagya ana say kidney na ho den no etesen ye hwɛ wo jonso na ye hwɛ wo mogya na ye scan anti Tembia, check your pressure no. Also check these organs so. And it's a similar advice for diabetes. When you mean because they be sugar no go now check it. Also check it now. Share organs a bit me affect no.
Okay. 0551599933 0551444933. Text message mum and about say me watching your friend Esther. Me how am wo mu pa ne say anytime a menum pressure duro no enu mum na ma meti eye me ya pa.
All right, so like I said no, it depending on the duro kwa am de man.
Okay.
And yes, we hear that sometimes, but ebi wo ho a in two cases ebi wo ho a pressure no emba down. Send ye pen no ebi wo ka so menu meduro no nti duro na ma meti ya me ya ba obehwe na the BP na 200 eti enye duro no pressure na da ho wosoro nti ba ye check na pressure no e wo form na nso tie o ya enro ni bi wo ho a e ma that side effect nti e besesa eti onko hospital na on cancer doctor ne waka yi a most likely e besesa ama na another one likely emanity ni nyane ya
na ade ne komu ansa na pressure dread obi atoso bi kompempi no ye di nipa ne tu so wie ansa na ye hunu se ohaw bi wo ho
sa eno de sa na tie un se nipadua no obi ade different oti ho yi ne nipadua enye adekro na ye disua yesua no it's for the general population nti ubon say dro bi wo e beje wo enjeme but I wouldn't know until my shasia.
Okay.
Until there are common ones I be a shasia. Until your shasia, depending on how I'll be responding, and you be who near be. Obi or no might be a shasia, depending on the BP. No matter so, where the way I'll be net, you'll be here, drove miensa. But ebia young family no in shasia, and you how I'll be responding. Okay. Depending on how I'll respond, you are me no baba na obi near come until you answer me the third one grab account. Ebi wa two no still about from near nam 200, I feel about 160. Ebe you answer me the back account send a beba form. So the aim na say pressure no ebeba baby ya pese one at least less than 140/90. Yeah. Okay,
me sure say calls no na intimi emba but menya message kakampacha number ni 0551599933 me sma fa na a drop it 0551444933. Let me read this message. Osi good afternoon prof nyamishra mo pa ene mo nchirechira mo de maye enu nti pressure no so obi de aduro ni so obeda so till the end of the person's life ana
no ye be shase ye can be bisa. Now what I would say na say fatu trimu say honamako ane dumpempen so bi a ehia emwa.
Okay.
Ye didi da bia we don't complain. So ubedu baby a honamako anasesa kakra nti ebehia support. So support no if it would entail say take one or two medications yen start endwen ho say it is sometimes like that. Okay. Now ebia weight was through ebia what wonchine so and all like I'm saying ebia what shall say na drone 3 4 possible say lifestyle no utimi ye ni a ye be wie na be dro a wo fa no ba ko dakro which should be manageable but also ya tia say but I say car cry yechi wo to car na fresh to be honest one when ye cry service no cry wo ditum cry nya problem
to tear rubber
e be twia for a while
top of hand
good I feel wo to car bia we twi ni be 20-30 years bo say dem bia na otifitem well it is an mindset no I mean body ni yin no na near sesa. And if it will take 1 or 2 tablets to ensure that things are going well, we should not run. But rather, you could say you suro ni anoma and na we go. And not which is what we can avoid.
Okay. But why audio need the mean to me and kind. Good afternoon, doctor. If me justice, me that pressure drew so and me blood pressure no see 180 by 130. Me twaso and I mean I.
Also 180 by 130. On can question on
twaso
na say ma for eti me misuro kan say nia onom no kra e ma no ma baby aye pe no eti most likely say or say ye di bi kan kra na ba 180 130 there what bet me nya stroke kra o nti mpacho who doctor this week here na ompe binka ho be ma BP number less than 140/90. Better still 120/80.
Ubetimi no message number 0551599933. Or say wo low pressure so a reading necessary say low pressure in tank but no dey power hu.
Oh, and no men kasa ano den per se, because in most cases no omo in fact because low pressure there may be say nipedua na te say. There are a lot of young women especially omonam ho blood pressures are eyema no 90/60, eyema no 160, because onye nipa kese. And in as much as a community me pump it to all the organs, ne nisu nchi no unless we bibi kakra wa bra na bibia, I wouldn't bother about it. Now a basse be a pressure also. Now we no medro na fe a cough form dodo a. Ubon se bema we ni switching wa na so sorry ka na say wo hima na say wo tehwe na bibi. And no be hu doctor, ho no na ye best start here then atete nro ne so ama.
Okay. Okay. Doctor, low pressure no so no dey na deba.
Never be brave. But in most cases, no low pressure, no when it happens, a BBA, to be honest, unti minfa 90 feet. You better go to hospital.
I see.
So no, yeah, handle. The problem with high blood pressure, and say I'm for them and you're more but low blood pressure, na make when this switching unti mikre nyina ho na nneema. Oh, you better go to. And that you figure out, because normally near the band say be infection, typically be infection. Now say we yamahwi and now afi bebrebe ama o film ha. So nti nema sa no yamfa na fie. Eti wo pressure ya chichire so we low na ho ye there, to be honest that low pressure no enya problem.
But enya dey et also e bibi na koka na
bibi na ya na normally e koka no. Nti won say ye be correct infection na wi ana ye be treat akoma yare na whatever it is the buy na won say na BP na e kama wo be won say wo kra ho ye na wo kofi something we can always correct. But no dey see entina ema won tina fie. Enya bibi a esi a ye hu esi a yebehu pa. Wo ti wo sesi a wo ko asori ana bibi na pressure no drop ya. Ye be peja ona bia na wakoba bia yebehu. Say ne pressure no call from enti na ehu ya no ne yen ya hwehwe. The enti na pressure no call from ha. But low pressure nye bibi a yenya de enenam edi asa wa sorry da bi. But high pressure ne de amafo di asa.
Hi doctor, please I want pressure medication but my pressure de be 111/63. Is it okay?
It's okay in as much as only symptoms be then it's okay because it's around the 120/80. Yeah.
Okay. Good afternoon. Ubisa ni bibi about tiare. Mostly benkum ananifa. What could be the reason? He didn't answer.
So it depends. And I answered, and the answer no was that there are so many organs that won't trim. So bibisa no on radio mean to me and can no. We need to assess you. Yet me who say a way and as a way and a day. But
diarrhea goes beyond just the pain out.
Oh yeah. Diarrhea na make an bibia a wo tirimu no. It me more diarrhea. O se cry or yet me more diarrhea me boa. Unya kata. Unya kata uti o ya me boa. Na make an we ni waso and then the brain itself, from all the other generalized cause of headache, migraine and manti. You know mean to me also a hospital because then we'll find out. Obeba ni tiani obehwe na so infection bi na we treat antibiotics 1 week na no one on ekọ embabio
minima the cronti and the calls in intime ma but messages ne baba obetimi a try 0551599933 0551444933. Good afternoon. Patros herbal male vitality medicines kama o say na kama if say na natural na so say well doctor bi akama na te say enye papa. In the doctor Pacho ne how pa ni say or premature ejaculation.
Inti wo otimi kan mfie ne nneema nka I would have addressed it much. But what is he calling premature ejaculation? And do it to be a sex education across here to your book near amafo be anymore. In this day and age we assume that every person who gets old knows how to handle and manage sex. No, it's not true. And yet, bibia ye to ye butcher. And unfortunately, as a society, if you are not careful, we have left this education for the pornography people to teach people. So there's that mindset. And on the moment, there's that mindset. Say only about that. Also, that 45 minutes because niya share lasted for 45 minutes or so. But niya minutes to be editing. That's the word.
Cut and paste.
Good. So now, what are you calling them? What are they? because a premature ejaculation. You've slept with a lady for over 10, 15 minutes or over 5 minutes. What are you calling premature ejaculation?
I feel say maybe na obano hum by. Nti so oba ne ho maya ono ne di kan di aba ne de feel say premature.
And that is why there are ways around this. How you handle the woman even in the bedroom is important. Your focus is not you. Your focus, like that simple example. You say to say hot plate, benano. It takes time to warm up. And man also I say gas cooker warm. Na yeah car no.
Money cylinder there no.
Cylinder gas no. Aha no.
But then there was
good electric cooker. So it will take time to warm up. Now, when you are in there, there's not a sex education, but when you are in there, your focus is to take your time for the woman to arrive before you.
But your next week, mommy, or you don't come with good sex.
Ayo,
and
so, friend.
But I made you permission or for one.
Yeah.
So I saw it too.
So I have more good sex in the
German. So
the point in the say, you may now need to focus. If the definition of good sex is sort the wife before, then indeed focus on sorting the wife, and after the wife comes from memory there, then you can release at any time. So how you go around it, the foreplay and all of that are extremely important. So it's not like jig 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 and then you are done. And everybody would have premature ejaculation. I'm sure we'll take our time to go through this, because I feel a lot of people just get it wrong, and that is why they think some here and they go take these medications and then they bring problems. I've spoken to a lot of young men who come in and say and you examine the person, it's like it is okay. You get my point, but it's mentality. Until now, may fair droopy. You see, my worry as a nephrologist and a kidney doctor is where they go take medications. They don't even know the content of the medication
just because
they are hoping they
are kidney.
I don't know how.
Your friend Kwadwo. Good afternoon, Prof. Possible say someone's EGFR to go up after pressure is maintained and improved after the pressure caused it to come down.
Yeah.
EGFR near them.
And only a share kidney now. Very good question. So, and I can't say pressure no cosura and my kidney now no conform. Until stop it. Pressure no now my pressure near come and my kidney now okay. So that's a very good question. Well done.
Minya be me na or can premature ejaculation. Was I don't want to be specific with the time I last. But I don't last for even 4 to 5 minutes when I penetrate. Any bros me for a number cram. I know my problem. That is why I want you to help me. Message me. Say me friend producer no me who what type it.
Also me nyada German because
on last for but the sex and I will say how many minutes.
To be honest,
for mun share Dr. Mrs. Tan on the street.
Who's that?
Because it and no can one say obi ho dey drink.
Exactly. No, and I've personally obi baba ne kidney na ho na kofo we say ansem na akodu na me no medru, because I ask them directly, because I know a lot of these young guys do that. And to be honest, if you do 5 minutes and that 5 minutes of penetration, and at that, because to be honest, sex being satisfactory is when the two of you are able to get your orgasm. That is it. If it is 2 minutes, both of you are happy, done. If it is 5 minutes, there's no cut-off time.
Okay.
But that's why the way we go around it is such that you need to focus on the woman first. So ladies first, like they say. When you sort out the lady, then when after your 2-3 minutes, at least on also you are done. Okay. But there are techniques to this, yeah?
Techniques.
Yeah.
It takes experts to know the techniques.
Now man can number drone and they hear me. My brand man can number drone be why at least for starters.
We are now the number not wafrel because also good afternoon. There were differences in the right blood pressure for the two genders and a man and member like do we have the right measurements for hemoglobin level for the male gender and the female gender?
Very good question. So yes, for moja do one there HB there say my there member there but pressure there unisex.
Okay, that is, do you have the right BP figure? Systolic 120, not diastolic 80 for male gender, and a different blood pressure figure for the female gender.
And they're unisex.
Okay, and they're gender.
Genderless.
Okay. Or say I have checked my pressure and the reading is say I will check it. Yeah, that's it.
Why are there? Whoa.
I have checked my pressure and the readings are 120 by 75. 68.
What pass it?
Is there a problem?
What pass it?
Okay,
what pass it?
But I am going checking the kidneys.
What pass it? Me that's pa. Oh, me new. So I'm busy me new.
What check your money? Okay, Sylvanus and so say and for advice say we no beetroot and a natural remedies be my pressure no coffee.
Okay, Sylvanus, me programs manager. No. Nah, so to be honest, like we said, virtually all the fruits or most of the fruits are good for your blood pressure because potassium na woman and nuama na eboa. Yes, e na bi DDBH. But near hamine say obi betimi abeka say oh se ya ka say pressure so ntia fe mi konom beetroot nko na we jai pressure dro no nom. And that's my problem. Now, let's not focus on just one or two. I mean, our beetroot, our ginger, our turmeric, our wine, all of these things are generally good things that we have to use for our food, right? But my worry, let's say, I'm for 2 minutes because of course, I'm on pay your drone for starters. It's when you say, oh, it's a cocoa, so then the bitter cocoa, about my BP.
And I dear to be murphy, bitter leaf,
so do all of that. Take the blood pressure medication. Blood pressure and a buffer, we would now reduce your medication, no doubt. Or exercise, what one change. So everything should come together to aim for it. But let's not say so. I'm not me the menomo insure me the lime 2 munti and long kwabema BP number from by itself. Will BP number 180, 110. You can drink all the beetroot in the world. My BP number 4.
I am very slim, but my BP there be a 150 by 90 and a 140 by 80.
I was so
slim na make and last week Dr. Dakwa buy no or say cholesterol no cra ni patia dey she
no. You see tia for no cra na e wo ye moja mu mo. Akasia no dey e wo almost system no mu sort of don't assume that oh menye ni pakasia into my cholesterol is not high. Never. It has nothing to do with the weight.
Me pacho me ma ha me da BP medication so I'm not dependent was a Micardis.
I'm not dependent.
MICARDIS.
Okay, yeah.
Okay. I was placed clopidogrel. And pacho we mean ATOR. But this was
that's atorvastatin.
This was giving me body pains ono mana na hona me ne ya
atorvastatin
ai and omu change man no simavat hwan no but still ne honam da so ye ne ya
okay
into we jai say nro ni nyina wakwakoye kidney test waye liver waye ECG waye echo but still me bre but my BP is okay now and chance no abre especially with shoulder and joint pains o say friend 50 wodi mfie eduonum ba
good interno sa na o say hwe ne nti abre e bi kra na nya duro no e bi kra na nya BP because in American BP na to be more symptoms we asa but na o ye o kan na ema me ebo mi hu kakra because with those set of medications o jai ni nyina will run into trouble. Typically, atorvastatin na ya na ema mo ya mo ya, especially na edona monum na nadwo no atorvastatin no. It will be normal depending on the doses and on some muscle aches here and there. Inti no na o say ye hwe ho asam kan. Ti de ko hu doctor na oni di nkomo a obehu ni obe.
Aka 3 minutes na ya pon. Inti doctor de beja ne number no na mo fa questions no. Ema no enkenka menu abema but I promise doctor. Etie for doctor say next week o ma na yeraba.
But you must say me kasa. Tell me what how much. Oh.
Doctor.
I can't 2 minutes.
Hi doctor, I'm on pressure medication, but my pressure is always around 111 by 63. I find it difficult breathing of late. Anything. But on my kind last message, and February maybe na men kind. Medin fear do an 48. My pressure is 182 by 129. Minya symptom be a koso.
Oh, pressure. One hwɛ ni ya ebe ma stroke, ebe ma akoma yare, ebe ma kidney na ho aden akofo. Mesrew. Ko no mo hwɛ ne ntia pressure no was ro. Ne yen hya ase ma wonro ne efutu a ma ye no. The one chin and all that pressure I was so pa.
Good afternoon.
Me do how bro. Why Mr.
Me pressure and be remain high even me know me pressure draw ma ye maduane nyina kama afi na ko obi atimi aba unua ya pon ye ntimi fa ko obi abi wonu maduro no ye diet modification but still the pressure no wa na was
good. And that is why nyoma san they see a specialist because I keep saying say menim BP emma form. There are always options about BP number form. BP number form, so there your risk of stroke. When you can go blind with one check of pressure. Must me hit you when you know me can when but you can go blind if you don't check your blood pressure. It be affect you akoma. It be more heart failure and I say akoma yari and your pa. Oh, nani who you pa now ko. And I say be affect your kidney. So let's not keep the blood pressures high. We check your blood pressure anytime there above 140/90. No, say you can get any of these conditions.
Obviously, for friend phone lines in at home, so you're home. Doctor, I'm on number, Mr. Ona Monfro, because then for me calls the messages so adore
Mate. So that will be the facility number. No? So 059 222 17 28
059 222 1728 059 222 1728. I don't know what I'm kana. So obi ni bisano makano.
Say upon there upon.
Your last words.
Medasi for the invitation. I think my last words and pressure ehuhia pa. Me obi amfa na di niagro. Especially we obi a we di above 40 anya se busumi mienu ana busumi nsia bia ho ana wa check e kosoro a bacho in fact yanya ne ebeye na price so o te won chene so we didi ye o exercise insane nnuama ni nyina no e ba se kosoro a menwane ko ne yen kire one oba to de bia se na obi kan ye to de bia nro ya de ma no once a day anya bibia ne fire din bia sa nti me ensuro ye nro no rather ye nsuro ne a ya num nro na e de bebre me tell who a man for bebre obaba na stroke na nnuama 40 something years na ya asefem kakra and we can prevent it. We can really fight against hypertension if we go and work together. Madam say
Abusa for Sada Kessben Koma production team headed by Mr. Samuel Edujemfi. Me did the adwachewa next week any doctor Mrs. Tano ebe good sex ewa ha because papa na sem na o kan doctor sem na o chechim o si kume sorry ama dwumadi eto aso aba nyame insha
It was